Hello, everyone. This is Ailey here, your professional pet groomer who has it all for you. I want to thank you for tuning in to another episode of Groomer Has It. Today, I have a special guest with me. Her name is Francesca, and she's here from Easy Pet Dental Care. And we are going to talk about the importance of dental hygiene for your dog and your cat. Francesca, welcome to Groomer Has It. I want to thank you in advance for being able to take this time out of your day to be here today, and hopefully we can answer some questions for dog and cat owners.
Yes.
How long have you been in business?
Since 2015. We started the business. I was just admin running the business, getting it working. And about 3 years into the business, so about 5 years now, I've been doing the dentals myself and teaching others to do it as well.
What made you want to do this?
I've been in the veterinary field for quite some time. I want to say on and off for 20 years. And I just love being with animals. I love helping them and in very holistic fashion, the most holistic fashion as possible. And I think that there's some instances where we want to try to take care of our pets in a way that doesn't put them at risk as far as putting them under anesthesia. And there's also medical reasons why they wouldn't be able to, and as well as some people just not being able to afford it and being able to help the general population of helping take care of their pets. It's not a very well-known thing that people knew about. You talk to the majority of people and they don't realize that pets needed to have dentals. It's just become more popular, I want to say, in the last 7 to 8 years, more or less.
Yes, I think so too, just because I recall, when I first started having dogs, I never knew about dental cleaning or dental hygiene for my pets until I did.
Right.
So that's why I feel like today would be good to answer some questions. So I've gathered some questions from my clients and from myself, just so that we can bring some consciousness and awareness to
Absolutely.
To everyone that's going to watch this podcast. So my first question it would be, why is dental hygiene so important for dogs and cats?
Well, the dental hygiene is crucial, the same as for us, because it can significantly affect their health. It can cause not only just the pain and discomfort of having infection or loose teeth or tartar buildup and gum inflammation, but it can also travel in our bloodstream and their bloodstream and affect their organs. It can cause liver, kidney damage, liver damage, heart disease. So these are some of the things that you want to eliminate by having consistent cleanings for your pets, as well as us, but for your pets we're talking.
So the dental cleaning for dogs and cats is kind of similar to human dental
Very
cleaning?
similar. Much more similar than when it's done at a veterinary office. Absolutely. Because it's without anesthesia. So without anesthesia, there is some limitations, which we will go into further detail. But it is very much just like ours. The same kind of instruments, the same kind of process, same kind of patients to deal with, the cats and the dogs. As it's kind of, I compare it to like a kid's dental hygiene.
So like working on a child.
Yes, it's like working on a child. Absolutely.
And I do get this question a lot. Does this procedure hurt? Because obviously when they're under anesthesia, and now we're talking about obviously non-anesthetic, that is the service that I provide in my business. And that is the service that Francesca provides as well. It's non-anesthetic dental cleaning. So when you get it done out of the vet, it's with anesthesia. So people ask me, does that hurt the dog? And my answer to them, does it hurt you when you go get a regular dental cleaning? Not
Right.
extractions, not just a regular cleaning.
Right. Well, first and foremost, dogs and cats, well, pets in general, have a higher pain threshold than we do. Not to say that this is painful, but also people also have different pain thresholds. I mean, I can go get an actual, a very deep cleaning without any anesthesia, and it doesn't bother me. And my husband, just for a regular cleaning, he wants to get put out. He wants to get put under because he's just a chicken for everything. So it really, it can vary from pet to pet. And it's not really the pain factor, it's the anxiety factor. Because I'm sure my husband doesn't feel any more pain or less pain than what I feel. It's just the anxiety of it and the fear of it. So that's it, which kind of leads to why we want pets to start as early as possible. Really, they should start like right around the 9 month, definitely by the year, just even if they don't need necessarily a full cleaning, just a general polish, just to get them used to the process, so that way it's something normal for them. I mean, it's the same way I'm sure with grooming. If you get a dog that's 5 years old and has never been groomed before, that's gonna be something else compared to someone a puppy that you've had that has been coming since they were 6 months old or 3 months old. It's just something that they become more used to. So it's something that they get very used to, and pets will handle it differently. But for the most part, no, it's not. It shouldn't be a painful process at all whatsoever.
Okay, so let's get down to business. And what is periodontal disease, and how can this be prevented?
Okay, so periodontal disease, also known as gum disease, it's a bacterial infection in the mouth that can affect the gums. It'll affect the teeth, and it'll affect the ligaments that hold the teeth in pets, and it'll also affect the bone, which eventually is what that causes the teeth to get loose. Dogs that are usually over 3 years old that haven't had consistent cleanings, you're 80 to 90% of them already have dental disease. If we catch it early on, it could be treated and somewhat reversible. But in its later stages, all you can do is just treat it and help try to keep it maintained.
So this is a disease that once the animal gets it, there's no cure.
There might be an aggressive treatment that a veterinarian could give, just like us, with extensive antibiotic treatments, but it's very rare. It would be very costly and very rare.
How do you prevent it in order to?
Consistent cleanings. It would be definitely consistent cleanings, and starting early on. This moment that we see the yellowing and a buildup, anything that looks thick, it's no longer a film anymore. Now it's already a thickness. That's already starting to affect the gums, because it starts to push on the gum line, and that's going to start causing the dental disease right away.
Okay, so when you say consistent cleaning, you're referring to a professional dental procedure, or are you referring to home brushing every day?
We're talking both, all of the above. We need to make sure that our pets are getting consistent professional cleanings, whether it's anesthetic or non-anesthetic, but also the day-to-day and weekly maintenance of it. And the reason I break those down is because there's some things that they can do day-to-day, as far as gels, sprays, water additives, food additives. And then there's also things you can do weekly, which is brushing. Now, if you want to start a routine and you have the time and the diligence and the opportunity to be able to brush your pet's teeth every day, that's amazing. But realistically, that's not what's happening.
Yeah.
So I usually try to tell my pet parents, use something. I give them a lot of daily options, and then tell them at least once a week you need to do a full brushing, and then every 6 months or more so, and we'll get into that also in detail, a cleaning.
On my Instagram, which is Groomer Has It, I am going to leave links for the sprays, for the gels that you guys can purchase. If you also follow Scotty Paws, you will also get those links there. That way you can already be on top of the ball, or ahead of the game. However, if your dog's teeth already need cleaning, you adding these things now are not going to prevent the buildup or from obviously from being there, but you're also not going to be able to remove the buildup. So my suggestion is always to get the teeth clean, then start with the gels and the sprays or the water additives, because if you don't get the teeth clean, then you're really not cleaning or doing anything for the tooth, because it's not exposed, because it's dirty, because it has buildup in front of it. So you're really not doing anything. So you always have to get the dental cleaning done before, and then you start using these products that are going to help you in extending, I guess, the time that you do the next cleaning.
Correct.
And prevent some of the buildup that gets on the teeth. These products do not attempt to not cause the buildup to happen. It's just going to prevent from being so aggressive.
Correct.
I guess that's what I'm going to say.
Yeah, it helps slow the buildup. Slow the buildup.
That was the word, slow. Slow the buildup.
Yes. So some of the signs of periodontal disease is if your pet has bad breath, particularly like a rancid smell, like a rotten I usually say it, rotten meat smell, usually is an indication that they already have an infection. When that happens, they do need to visit a veterinarian because they will need antibiotics for that. I see a lot of my clients in those advanced stages, and I do recommend that they get, doesn't mean that they can't still do a non-anesthetic dental, just that they do get an antibiotic to put their dog on, because during the cleaning, there is going to be a lot of bacteria released, and they do have open pockets. So that's one of the signs, is really bad breath. Along with that, the red swollen gums will be indicative of that. Loose or missing teeth that are falling out on their own, as well as difficulty eating, or they drop their food, especially if they eat pebbles. If you see that they pick it up and they kind of like drop some of them, it's because they probably already have loose teeth, or their gums are very sensitive, where when they bite down, that their teeth are moving and it's causing pain, so they drop their food. Discoloration in teeth as well. There may be like a purplish, a reddish, a grayish. Those are indications that the tooth is damaged. There's some sort of damage to the tooth. The yellow discoloring, that's just normal. That happens with age, and not to all of them. Just like to people, not to all of us, some of us. The same thing with pets. Not all of them will have it. I get some really old dogs still have pearly whites, and some really young dogs already have yellowing of their teeth. That's just genetic. And if you see any changes in their chewing habits, if you see them start to like kind of chew, kind of move their jaw around, a lot of times that's indicates that they already have a loose teeth, and what happens is their tooth kind of gets misaligned. So they kind of do this chewing thing to help get their tooth in alignment so they can close their mouth the right way. So usually these are a lot of the key signs that I can notice right away, which is smell, the way their teeth are lining up. When I first take a look, that'll let me know right away that there's loose teeth, there's big pockets, and technically only a veterinarian can say that your pet has periodontal disease. But we can tell you that there is some abnormality with their gums, and they are severely inflamed.
How often should a dental cleaning be performed?
So a dental cleaning essentially should be performed every 6 months. However, there are special circumstances, those special breeds that their teeth accumulate a lot more. If a pet has a specific condition, they could also require more often. If a pet parent just doesn't want to see ever any kind of buildup, it could essentially get cleaned more often, which is a plus when it's non-anesthetic. When you're dealing with anesthesia, you can't. The vet shouldn't put your pet under anesthesia more than once a year. So with a non-anesthetic, it's every 6 months is recommended. Some breeds can go every 3 months. Larger breeds, some breeds can go annually. So there would be the difference. But the consistency, what we aim for, when I tell my clients, is unless I see something like a small breed where I say your dog needs to get done every 3 months, I give them a 6 month. And then I say at 6 months, for my large breeds, I sell them at 6 months, look at the teeth, kind of gauge how you feel about the teeth, and give me a call whether you want it done at 6 months or whether you think you can wait the year, depending on how it physically looks.
When you say look at the teeth, so this is a good one for for the owners. When you said look at the teeth, what is it that you want them to see to let them know that, hey, my dog needs a dental? Because when they come to my shop for grooming, I evaluate their teeth and I let the owners know that, hey, your dog needs a dental, blah, blah, blah. But how can the owners check, and what are the signs that they can see that they need to look for?
They want a lot of people just think they want to open up the front, or in the front, or the canines. It's not just that. The tartar that builds up the fastest is going to be all the way in the back. So you kind of have to pull the cheek to the side and look at the back molars. That's where you're going to see the biggest buildup. Not the biggest buildup, the biggest visual buildup, because a lot of buildup happens inside the back molars, and as well as inside the incisors, just behind the teeth. And a lot of people miss that spot. And that's what causes, in the small breeds, causes their front teeth to get very loose, is the tartar that they don't see, which is behind the teeth, behind the top and behind the bottom.
Okay. I'm going to grab my dog real quick just so we can show people here, how exactly, because when you say, want to check the back teeth, we want to pull the lip back, I want to be able to show that. And I'm going to show you guys how you should be inspecting your dog's mouth, just so that you She explained it, but I'm also going to show you a visual so that you're able to see, how to do that and not hurt your dog. Okay, this is Hannah. For those of you who don't know Hannah, Hannah is a Scottish Terrier. She is 7. She's almost 8. And we're going to do the high five, wave at everybody, Hannah. I'm going to open up and lift up her lip just to be able to look at her side teeth and her front teeth. But we do want to get to the back. So I'm going to, and this is kind of hard if you don't really like deal with your dog. Kind of just open all the lips up and look at it. And
yeah, you can hook the,
just get in here. I have it hooked this way on the lip, and I'm just gonna pull it back. So I don't want to hurt her. I have long nails, so I don't want to hurt her, obviously. And kind of check the back teeth.
And that's where you would see the tartar buildup right in here. And then on the bottom one, which you can't always see because your dogs do have an overbite. But that's where you would see it here. And especially like these 2 teeth right here.
I can't even see the back one. Okay, there's a little one back here.
When it's dirty, you can see it.
Obviously, yeah.
So those are the teeth that we're talking about.
And we want to make sure that we are looking at both sides. Just because one side is clean doesn't mean the other is clean. It's okay.
Correct. Okay. Some dogs chew on one side more than
others. So we want to make sure we open wide. And if you need help, obviously grab someone that can help you. If your dog doesn't let you do this, then just bring it to a professional. You can always schedule an appointment with Francesca. And
you can also ask your groomer too. Your groomers usually have a pretty good idea.
If you come to our salon, I check and I will let you know if you don't want to put your hand in there and deal with your dog yourself. But because some dogs are not going to let their owners.
My dog doesn't let me clip her nails.
Yeah, you're good. Yeah. You're good. You were a good girl, okay?
Thank you, Hannah.
Say bye. Is there a way or something owners can do to prevent or minimize buildup?
Yes. Buildup begins immediately. So as soon as we clean Hannah's teeth, the buildup is going to begin already tonight. And that's why a daily regimen is important to help, maximize the cleaning and to help prevent the buildup as fast. So like starting tonight, you would use the gel because most owners are not going to brush their teeth every night.
Yeah, no, I'm going to be honest with you. I have the means to brush their teeth and they will let me. My dogs do let me do that, but I don't do it.
Right.
I'd rather just pay you.
It's a very normal.
I'd rather just pay you and you take care of it. But I am going to, and for those of you that have a hard time with your dogs or your cats getting that toothbrush in there and brushing their teeth, if you're able to do that and you do that, God bless you. If you're not able to, then this is where the gel and the spray come into place because that is just an easy way to just open their mouth, spray it. If they let you put in the gel, then do the gel. We prefer the gel, but if they don't, then the spray works, good too. So you have options, and those realistically,
a brushless enzymatic type gel. A lot of them are holistic, all natural, is gonna help. Now, I don't want all the veterinarians start to bash us and PETA and everybody. Okay. You should brush your pet's teeth daily. We do know that. But we are realistically, as pet owners and in the pet business, we know that doesn't happen.
Yeah.
So we just want.
Not only does it not happen, but there are some dogs that just
won't let you.
They won't let the owners.
They won't let their owners.
They won't let the owners. They'll let me because I do things here, and their owner's like, "How'd you do that? I've never been able to do that." I'm like, "Hey. I'm the alpha. I'm in control." They know that, but with the owners, they also know that they're not the alpha. Right. They're not in control, so they get away with things.
I've also seen the same kind of noticeable difference with someone using these things that I have been suggesting is the brushless enzymatic gels and sprays, and I have seen a big difference with them with the pets that I've seen on pets that I have 3 or 4 years that have started on this. When I have pictures, I can go back and see like every 6, when I would do them, I first got them, it was terrible. The next 6 months, they were kind of somewhat consistent. And then when I see them, I'm like, how have you been? I can really tell you've been using the gel. They're like, yes, we got onto a routine. And I'm like, it shows immensely the difference.
Yeah, we know. So sometimes if you can do it, then obviously.
Right. So usually my recommendation is to use these gels, sprays, water additives, even though if you start, let me interject here, if you start your dog on a water additive when they're very young, that's great, or a food additive, what I would deter my clients from doing is starting a water additive, after they're 2 or 3 years old, because the last thing you want your dog to do is notice that something's there, even though people say, oh, it's not, no, you can't taste it, you can't smell it. But remember, they're way more sensitive. They can taste and smell things that we are not even aware of. So you don't want them to decrease their water intake because you've added something to their water or to their food.
Yeah.
So I never, I never really recommend those kind of things unless it's something you started when they were a puppy. And then chew toys, chew sticks. Rawhide is not great. Like the bleach type of rawhide, something more natural is great. Always want to avoid bones. If something seems really, really hard, and it's possible that it's harder than the tooth, one or the other is going to break. And it's just going to be up to you to figure out which one's going to break first, the chew toy or their tooth. And having a tooth break in a pet is very, very costly. So
Yes.
I always tell people that be very careful of what I see dogs with chipped teeth all the time. And I'll ask the client, do they do bones, this or that? They're like, no, my dog chews on rocks. I'm like, oh God.
Just to do like a recap, and I kind of want to just bring this home. If a professional is already telling you that your dog needs a dental cleaning, please don't delay it. Just because when you do so, there are more chances of getting periodontal disease. There are more chances of bacteria growing and creating other issues that are going to affect vital organs. So once it gets really bad, then Francesca cannot help your animal, and then you have to go to the vet, and that's going to cost you.
If it's bad enough that I can't do it, it's starting at about 800 and up. But if I can't do it, it's because there's already super receded gum lines. There's major infection. There's teeth that are needing to be extracted. So no, you're not looking at a simple dental cleaning anymore. It's beyond a cleaning. Now it's actual a treatment. A very aggressive treatment. Where they're going to start pulling teeth out and stitches and all the whole 9 yards. So
okay. So I didn't know that.
Right. Yeah. Once if
you cannot do it, it's because it's really complicated, and then it has to go.
Now, there's a rare circumstance that maybe the dental is not that bad, but the pet's demeanor is not going to allow for an anesthetic dental. That's the other catch. A non-anesthetic dental. Excuse me. If the pet is aggressive or and a lot of. And I've seen pets that are not aggressive pets. They're not naturally aggressive. It's just their reaction to their fear and their anxiety, which is normal, and some pet parents are like, oh, my dog's not aggressive. I can't believe he tried to bite you. And I'm like, he's not an aggressive. He's a very sweet dog. It's just, their reaction to being afraid and their anxiety. So it doesn't mean they're an aggressive dog. So a lot of people just think, well, my dog's not aggressive. They're probably not. It's just when they're put into a certain circumstance, just like any human or any other pet, that's just their way of defending themselves. So they can turn into an aggressive dog once they're on our lap or wrapped. And not necessarily, thank goodness, let me knock on wood, I've never been bit. Not like on purpose, on accident when I put my own fingers in the way. But they're very aware of your hands. They bite tools, and that's dangerous for the pet because I don't want them biting the tools. They're sharp. They can pierce gums. They can break teeth. They can swallow pieces of stuff. So when I say I don't want to do an aggressive pet, it's not necessarily just for my sake, but it's also for theirs.
For their safety.
For their safety. And also, you don't want to traumatize your pet. A lot of pets get traumatized going into a vehicle because going into a vehicle or going to a groomer. See, I'm sure you experience that too. So you get a lot of these pets that have been traumatized, and they're a lot harder to work on.
Something that I just remembered and I wanted to ask you is, I also get a lot of people ask me, like, how do they let you do the dental? Is there a wig?
Right.
So kind of explain a little bit about your process.
So I get down to their level. I make them feel comfortable. They're not getting strapped down. They're not getting held down. I do a swaddle technique, and they sit on my lap. I'm sitting on the floor with them in the same kind of position the way we get our dental's done. You're kind of laying on your technician's lap. Of course, we're elevated, and she's elevated, he or she. But in this case, I'm on the floor. They're on the floor with me. And just making them feel comfortable. It really does come down to the technician, because some people say, oh, a technician, I so many technicians have turned my dog away, and then I get them and I'm able to do it.
Yeah, but I've worked with other techs in this dental cleaning, and you have, I think, by far the person that has the most patient with the animals. So
right, it's patience. There's also a lot of other little things that I do, and I'm just going to keep those my secret, but there's a lot of other little things that I do on the side, and I'll tell you about that after off camera. But there are some things that I do that I think make a big difference as well. It's just appealing to the pets. You have to appeal to them, and also we have to. I'm not afraid of them. I'm not afraid of pets in general, because I know that they don't mean anything malicious. So when I feel comfortable, they feel comfortable. It's kind of like if you go into the doctor's office and the doctor, seems comfortable and very normal to what he's going to do to you, you're like, okay. But if a doctor comes in and says, oh my God, let me look this up, what's this, and then touching you and then flinching, and you're going to be like, oh my gosh, what is this guy going to do? Your anxiety level is going to go through the roof. And pets pick up on that very, very fast. So that is also another thing that I a lot of people have told me, like, oh, how can I do this? How can I learn to do this? And I'm like, you have to be a pet person, and you have to first of all not be afraid of animals at all whatsoever. I have one pet that every single time, every 6 months I do him, he comes off like a little piranha. I mean, he's so sweet. The second I wrap him up and I start doing it, he's like a piranha. I have to like blindfold him, and I have to let him know, and I have to wrap my hands with towels and gauze, because I know he's gonna bite. But 10 to 15 minutes in, he's like, okay, whatever. And he just lays there with his mouth open after that. But, his mommy tells me, like, listen, I can't get him. Nobody else will work on him. Nobody else. I need you to do it. So she drives about 3 hours for her dental. Holy crap. Yeah, she'll drive 3 hours to get her dental done.
That's good. Yeah. I mean, okay, so I want to...
So before we end, just so that we don't get a whole bunch of people breathing down our necks, not going to say that a non-anesthetic dental is better than an anesthetic dental. By any means. An anesthetic dental, they can provide x-rays, they can do extractions, they can give diagnosis, they can prescribe medications. So if your pet does need a dental and you have the means, and the veterinary wants to do, like a lot of people have a dental built into their insurance plan, by all means do your dental annually if it's already included. But I would, like me personally, I don't have pet insurance, but if I had to, and I had the means to do it, I would probably get my pet's dental, maybe like a full under anesthesia, maybe once every 5 years or 6 years. Maybe not even that if I didn't see a problem, because I have a large breed. But
I'm gonna say no to that. Like, I personally want to avoid putting my dog under anesthesia if they don't need to. If it's not a surgery, like I would see, like, okay, if your dog is going in surgery and they're already under, go ahead and do the dental, fine. But to put my dogs under when I know the dental can be done without it,
if you have the right technician.
And that's just my personal, I'm not speaking for other people. My personal is, I would not put my dog under for a dental. I would rather do a non-anesthetic dental yearly than having to put her down, in 5 years. If I keep up with it, whether I do it yearly or 6 months, if I keep up with it, I think I won't have any more issues that I would have to do a dental. I mean, an anesthetic dental.
An anesthetic dental, correct.
I don't care what my vet's going to say when he sees this. I don't care.
A lot of vets are going to push back. And that's because, you know what? Well, one, it's business, and it is...
Well, they do it in 15 minutes.
Well, they do it. Honestly, to put them under takes longer than the cleaning.
Right. The cleaning takes 15 minutes and once they're under.
And then the recovery process can be months.
No.
But with that said, I'm not going I'm not going to tell anybody you only need non-anesthetic dentals. Because I don't want to get pounded on. But
that's up to the owner's decision whether they feel comfortable putting their dog under or not.
And there's some that medically can't. Old age, health dispositions of their health. The liver disease, kidney disease, heart disease, epileptics. A lot of these pets can't go under anesthesia, and it just comes back down. And I don't want it. I'm not just promoting myself, because we find another really great tech that can do it, by all means. But do make sure you have the right tech that it's doing the right kind of job. I've had veterinarians take a look after my pets, and they've been amazed that they tell the pet parent comes back and says, "Oh my God, I took my dog to my veterinarian, and they took a look, and they're just amazed." And it always makes me feel good because I always want to do what's best for the pet. No matter how it takes an hour or 2 hours. If we have to allot that time or split up the time, it's important that your tech is not just rushing through like a process. A non-anesthetic dental does take time and patience to be done correctly.
I agree. I totally agree.
The big
question is, what's the difference between a non-anesthetic dental cleaning versus an anesthetic dental cleaning? Obviously, price is a big difference.
That's the number one.
But moving away from the price, right. What would be the difference?
Okay.
In those two.
Now, when you're seeking a non-anesthetic dental professional, you want to make sure that they're doing certain things. You want to make sure that they are scaling, they're removing the tartar, and they're polishing on both sides of the teeth, inside and outside. With that said, the biggest difference between a non-anesthetic dental and a non-anesthetic dental is really the anesthesia. One is done while you put them under, which requires blood work. It requires a veterinarian to, and an anesthesiologist to administer all that. So that's where your bill skyrockets. But the actual cleaning process once your pet is under is exactly the same. It does require a lot more patience without anesthesia because they are awake. So it's like going back to it's like dealing with a child because they don't know what's going on. They don't know what to expect. So you do have to be very patient with them. So when you are dealing with a dog, if they turn to the left, you work on the right. When they turn to the right, you work on the left. And you kind of go back and forth. At least that's the way I do it because you want them to feel comfortable. So an anesthetic dental, they're gonna do x-rays. Unfortunately, with non-anesthesia and being mobile, there's no x-rays provided, which also means you can't give any diagnosis as well, and there's no veterinary license to give the diagnosis. So that's another one of the differences, but that would be it. The cleaning is the same. It should essentially be the same. If you have a technician who's doing it the right way, it should be the same.
Okay, so I'm gonna ask you 2 questions that are not on here.
Okay.
One is feeding your dog wet food can cause more buildup than dry food? And the other question, before I forget, is, are there certain breeds that are more susceptible to having bad teeth and causing like more buildup than other breeds? Because in my experience, I kind of have seen some breeds that are the same age as another breed, and they have like really ugly, bad, smelly teeth, and then this other dog doesn't. So I kind of want to say yes, some breeds, but right. I want you to say which breeds in your experience and expertise.
Okay. As far as the food, that's a very common question I get all the time. I don't really think it has to do so much with the food. If they have an advanced state of periodontal disease, any food that they eat is going to accumulate in the pockets, whether it's soft or hard. Or house, whichever one, raw diets, as well. All of them will sit and get into the pockets, and it's all going to affect it the same way. I don't think, well, I know it's not the food because I've had pets in the same household, and some of them have the same exact diet, and one of them has great teeth and the other one has not so great teeth, and even the same breed. Which kind of heads into your next question. There are breeds that are more prone. Definitely smaller breeds definitely have, they're more prone to getting periodontal disease much faster. Their teeth are much smaller. They tend to be less of the chewers, less surface area. They can get, kind of brushed or get scraped in the process of them playing with their chew toys or this or that.
Can you give us an example of like the most popular small breeds that have these issues?
It would be, I would say, in the number one spot, I would say probably the Yorkies. The cute little things, but they do have typically the worst teeth. I would say
number one in the list is Yorkie.
I would say Yorkies.
Top 5. Let's do top 5.
I would say Yorkies, Chihuahuas.
Maltese. I'd say Maltese too.
I think
Maltese,
I consider all the
Pomeranians.
same, the Maltese, the Shih Tzus, the short muzzled dogs, just because their teeth are already repositioned in their mouth. They
Mm.
don't have a regular positioning of teeth in their mouth, so their teeth kind of invert. It goes right along with the pugs and stuff. Even though I don't see a lot of pugs get loose teeth, but usually Yorkies, Chihuahuas, Maltese, Shih Tzus, I mean, infamous for loose molars just because of the accumulation of tartar that builds up, and the second it starts building up, it starts loosening the gums and the ligaments and then the bone, and then before you know it, the teeth are just flapping around in their mouth. So, and when that happens, the food gets up in the roots, receded gum lines, and that can be a pretty nasty smell.
And what's the number 5?
I would say, let's see, if we have to get down to number 5.
I would say Poms.
Yeah, I think Pomeranians, and I would say Dachshunds are probably right.
Dachshunds too, yeah, they're right down
Pomeranian
there.
and Dachshunds, I would say, are right there, tie at 5. Yeah.
Okay.
And usually your large breeds have less. Surprisingly, I get that all the time. Like, oh, but it's a very large dog. Large dogs tend to have less problems than smaller dogs, so that's why I say it mostly goes down to the smaller breeds, because I can see a large dog. A 5-year-old large dog with never having a dental and a 5-year-old small dog never having a dental, it's a huge difference.
Yeah. I have seen that too. And just because we're talking about small and big dogs, do they all have the same amount of teeth?
They do have the same amount of teeth. Yes. Some breeds, their far back teeth may or may not come out. Some of their teeth right behind their canines may not ever come out, so they could technically have less. It's not that they don't have them; it's just that they never came out of the gums. They never came out,
but they do have the same amount of teeth.
Yes.
Okay, so my next question is, what happens when a dog has loose teeth? And you might have answered it a little bit before, right. and how does that make it worse?
Okay, so depending on the severity of the looseness of the teeth, it's going to be painful for the dog. So I get a lot of pets, if they're super loose teeth, they may even come out during the cleaning, because a lot of these teeth, if their tartar buildup is so bad, it's like almost like one formation of tartar. And so the second we start breaking off the tartar, that tartar was helping hold a lot of these teeth in place. And it's not a bad thing that they came out. It's actually a good thing that came out, because the sooner it comes out, the sooner that the gum can start healing. Because imagine that a tooth, just every time you bite, it just keeps, it's not even attached anymore. It just keeps digging and digging and digging into the gum.
That's gotta be
over
so
and over. Exactly. Or even if it's just like when we had baby teeth and it was like the last moment where it just only was attached to the gum, and we're kind of freak out because it's like, it's painful, but it's really not that painful, because the second it comes out, there isn't any pain. That's the same thing with the dogs. I see that all the time, where it doesn't fall out because it's attached to the gum, but it's not attached to anything else, because it's moving around. But if you kind of just pluck it out of the way, the dog didn't feel anything. They didn't, and it's actually a relief. I feel like I can see them like, oh, it's like it's no longer there. What a relief.
Would you recommend, if owners see that, like they pull it out themselves, or should you recommend that they seek professional?
I've seen some owners get pretty aggressive and do it themselves. It really depends on what owners feel comfortable with doing. Like I said, it's kind of like our baby teeth. Would you do that to your child? Like, I hold it, and when the dog turns, if it comes out, it comes out. Now, if I hold it and the dog, I'm not gonna yank.
Yeah, you're not gonna yank it off. You're not
that
gonna,
would be an extraction,
right?
And that you would want, because you don't know at that point if it's still attached inside inside the bone. The last thing you want to try to do is try to do an extraction yourself, and then you leave part of the tooth inside there. Oof. And then that causes a major infection. And then you just caused a big veterinary bill. Instead of just going and getting it done the right way, because now you have a whole nother slew of problems aside from just a simple extraction. Now it's a complicated extraction.
I didn't know that. So
yes,
I would tell you guys, it's okay to pull your child's teeth, but don't pull your dog's teeth.
Right.
Seek a professional for that.
Correct. Yeah, I would say that too. Okay. Because I
to be safe.
Yes.
I wouldn't dare do it.
Right.
I mean,
there's like those teeth that are just like kind of like, if it's hanging there and you see it like hanging there.
Yeah, that's different.
Like I said, if you just touch it and the dog moves and it comes out, it came out. But I wouldn't I don't like pull or anything.
Okay, Francesca, I want to thank you so much for being part of my podcast today
No,
and
thank
being
you for
here
inviting me.
explaining everything to my audience. And if you guys want to schedule a non-anesthetic dental, you can call Scotty Paws Pet Resort and Spa at 786-571-1917, or you can call Francesca. She does house calls at
305-632-4511.
Thank you for watching. If you liked this podcast, please go ahead and hit your like button, share it, promote it, let other people know, because we are trying to
Promote
dental health and create awareness as well. So thank you for watching. See you next time. Bye-bye.